Your fingernails finish growing about 6 months before you'll ever notice a problem with your heart, liver, kidneys, or blood. Which means if you're over 60, they may already be showing you something nobody's mentioned yet. 5 specific nail changes are tied to real, treatable disease. One of them is a symptom of a cancer most people mistake for a bruise. I'm Dr. William Lee, and today I'm counting down 5 nail changes every man and woman over 60 should recognize. From a subtle curve most people never notice, to a color change linked to your liver, to the one sign that should get you to a dermatologist within days, not months. Tell me in the comments, are you over 60 and have you actually looked closely at your nails in the past year? I read every comment and it shapes what I cover next. Nail changes are one of the most overlooked diagnostic clues in medicine. In one study of hospitalized patients with kidney failure, researchers found visible nail abnormalities in 76% of patients, compared with just 30% of people without kidney disease. And the nail cancer we'll cover at number 1 is diagnosed late in the majority of cases, simply because, at first glance, it looks completely ordinary. Here's why this list matters more than it might seem. Most annual physicals don't include a close look at your nails as a specific, deliberate step. A doctor might glance at your hands while checking something else, but unless a change is dramatic, it rarely earns its own line of questioning during a 15-minute visit. That leaves the noticing almost entirely up to you. Let's start at number 5, a shape change most people notice for months before anyone thinks to ask why. Number 5 is the spoon-shaped nail. Healthy nails curve gently outward, like the back of a spoon. Koilonychia is the opposite. The nail plate flattens and then dips inward until a drop of water sitting on top would actually stay put instead of rolling off. In more advanced cases, the nail looks genuinely scooped out, thin, soft, and flexible enough to bend slightly under light pressure. This shape change happens because building healthy nail tissue depends on a steady supply of iron-dependent enzymes and adequate blood flow to the nail bed. When iron stores run low for long enough, that construction process goes slightly wrong, and new nail grows in concave instead of convex. The connection to iron deficiency anemia is well documented. Koilonychia shows up in roughly 5% to 20% of people living with iron deficiency anemia, depending on how severe and how long-standing the deficiency is. It's also one of the few signs on this entire list with a clean, well-established fix. Replenishing iron stores, whether through diet or supplementation, frequently reverses the spoon shape over the following months. In my clinic, this is the sign I most often see in people who've simply chalked up their fatigue to getting older. Energy dips, a bit of dizziness on standing, feeling cold more often than everyone else in the room, all of it gets blamed on age long before anyone actually checks a ferritin level. There's one more layer worth knowing if you're over 60 specifically. In younger adults, iron deficiency is usually explained by diet or heavy menstrual periods. In older adults, unexplained iron deficiency gets treated very differently by most physicians because it can be the first visible clue to slow, hidden blood loss somewhere in the digestive tract, including from polyps or, less commonly, colon cancer. That's exactly why doctors take new iron deficiency more seriously, not less, the older a patient is. It's also worth telling this apart from something almost everyone develops with age: fine, vertical ridging that runs lengthwise down the nail. That kind of ridging is extremely common after 60, isn't linked to disease in the vast majority of cases, and doesn't involve any change in the nail's overall curve. Koilonychia is different. It's the whole nail plate changing shape, not just developing fine lines on the surface. If you're genuinely unsure which one you're looking at, that uncertainty alone is reason enough to have a doctor take a look. I once had a patient in his late 60s who'd spent most of the year managing what he assumed was ordinary seasonal tiredness. He mentioned almost as an afterthought that his nails had started looking strange. A basic panel found his ferritin was low enough to explain the fatigue on its own, and a follow-up scope found the actual source, a small, treatable ulcer that had been bleeding slowly for months. The nails were simply the detail that got the conversation started. So here's the move. If you notice this shape change, ask for a full iron panel, not just a basic blood count, but ferritin and iron saturation specifically, since early deficiency can hide behind a technically normal hemoglobin number. Koilonychia can occasionally point to thyroid disease or a skin condition called lichen planus instead, so it's worth a proper workup rather than a guess. That's number 5. Number 4 develops so gradually that most people who have it have never actually noticed. Number 4 is nail clubbing. Clubbing changes the entire shape of the fingertip, not just the nail. The angle where the nail meets the cuticle, normally close to 160 degrees, flattens out and can eventually reverse entirely. The nail bed starts to feel soft or spongy when you press on it. In advanced cases, the fingertip itself bulges outward, giving the finger a rounded, drumstick-like appearance. There's a genuinely useful test you can do on yourself in about 10 seconds, developed by a physician named Schamroth. Touch the nails of the same fingers on each hand together, back to back. In a normal hand, this creates a small, diamond-shaped window of light between the two nail beds. When clubbing is present, that window disappears completely, because the nails now curve too much to leave a gap. The mechanism is thought to involve increased blood flow and connective tissue overgrowth at the fingertip, frequently triggered by conditions that lower oxygen levels in the blood over a long period. That's exactly why this sign points so strongly toward the heart and lungs. Clubbing is seen in roughly 1% of internal medicine hospital admissions, and when it's present, it's tied to serious underlying disease in about 40% of those cases. Around 80% of clubbing cases trace back to a heart or lung condition specifically. Doctors actually grade this on a 4-stage scale, running from subtle nail bed softening in the earliest stage to visible fingertip bulging in the most advanced. That grading matters because it means by the time clubbing is obvious to the naked eye, the underlying process has often already been developing quietly for quite some time. Lung cancer is the single most common adult cause, though clubbing itself only shows up in an estimated 5% to 15% of people who have it, so its absence doesn't rule anything out, and its presence isn't a diagnosis on its own. It's also associated with chronic lung infections, interstitial lung disease, congenital heart defects, and less commonly, inflammatory bowel disease or liver cirrhosis. One important caveat: a small number of people are simply born with a mild version of this shape, inherited from a parent, present for their entire life without any disease behind it at all. What matters most isn't just whether clubbing is present, but whether it's new, a genuine change from how your fingers have always looked, especially one that's developed over months rather than years. If your fingertips have looked this way since childhood, that's far less concerning than a shape you've only started noticing recently. I remember a patient who'd smoked for over 40 years and finally came in because his wife noticed his fingertips looked different in a recent family photo compared with one from a few years earlier. That side-by-side comparison, more than anything he'd felt in his own body, was what got him into the office. His chest x-ray that same week showed a mass that hadn't produced a single symptom yet. The self-check here costs nothing. Try the Schamroth test on both hands tonight. If the diamond-shaped window is missing, or if you've noticed your fingertips looking rounder, or your nails curving more than they used to, mention it to your doctor specifically, especially alongside any shortness of breath, chronic cough, or a smoking history. A chest x-ray and a basic oxygen reading are usually the first 2 steps, and they're neither expensive nor uncomfortable. Number 3 shows up as a color change most people write off as simply old person nails. Number 3 is Terry's nails. With this pattern, most of the nail turns a pale, opaque, almost ground glass white, and the crescent-shaped lunula at the base often disappears into that whiteness entirely. Only a narrow band of normal pink or reddish-brown remains, right at the very tip of the nail. It typically affects every finger at once, and it tends to be a little more pronounced on the thumb and index finger. This pattern was first described in 1954 by a physician named Richard Terry, who found it in 82 of 100 patients with liver cirrhosis. The connection has held up well since. A more recent study of 1,000 outpatients found Terry's nails in 25.6% of people with cirrhosis specifically, and when researchers adjusted for other conditions like heart failure and diabetes, cirrhosis was the only factor that remained significantly linked to it. When this sign is present, it's about 93% specific for cirrhosis, meaning it doesn't show up randomly, even though not everyone with liver disease will have it. The proposed mechanism involves reduced blood flow to the nail bed combined with an overgrowth of connective tissue underneath the nail, which changes how light passes through it. It's worth knowing that Terry's nails aren't exclusive to liver disease. They've also been associated with congestive heart failure, diabetes, and simply advancing age on their own. So this sign works best as a prompt for questions rather than a diagnosis by itself. It's easy to confuse this with a fungal nail infection, since both can leave nails looking pale or discolored. The distinguishing detail is texture and pattern. Fungal infections usually thicken the nail, make it crumbly or ridged, and often start at one corner or the tip before spreading unevenly. Terry's nails keep the nail's normal thickness and smooth surface. It's purely a color change affecting every nail roughly the same way, which is actually part of what makes it a more reliable systemic clue than a fungal infection would be. I've had patients describe noticing this change and simply assuming it was what nails look like after 60, since a milder version genuinely does become somewhat more common with age alone. The detail that should raise your guard is how suddenly it appeared and whether it's paired with anything else: unexplained fatigue, a change in appetite, or skin that started to itch without any rash to explain it. So here's what's worth asking. If you notice this white, ground glass appearance across most or all of your nails, particularly if it's new, bring it up alongside a request for basic liver function blood work. Fatigue, unexplained itching, or swelling in the abdomen or ankles alongside this sign raises the urgency considerably, and none of those symptoms should be brushed off as simply getting older either. Number 2 involves a nearly identical sounding color change with an entirely different cause and a sharper dividing line. Number 2 is the half and half nail, also called Lindsay's nails. Where Terry's nails fade gradually into a narrow pink tip, this pattern has a hard, clean boundary. The half of the nail closest to the cuticle turns white or dull, and the half closest to the fingertip turns a distinct reddish-brown or pink, with a sharp line separating the two, almost like the nail was painted in two colors. This specific pattern is strongly tied to chronic kidney disease, particularly in people who need dialysis. In the hemodialysis study I mentioned earlier, 100 patients with kidney failure, compared with 100 matched people without it, nail abnormalities of any kind were present in 76% of the kidney failure group versus 30% of the control group, and the half-and-half pattern specifically was the single most common finding, showing up in about 20% of the kidney failure patients. The proposed cause involves changes in how melanin gets deposited in the nail bed, along with altered small blood vessels, both common consequences of reduced kidney function and the waste product buildup that comes with it. Unlike Terry's nails, the half-and-half pattern doesn't reliably show up with liver disease or heart failure, which makes it a comparatively specific clue when your doctor sees it. Age adds real weight to this sign specifically because kidney function naturally declines even without a diagnosed disease behind it, and routine blood work doesn't always catch that decline until a meaningful share of function is already gone. It's also worth checking your toenails, not just your fingers. The same pattern has been documented there too, and toenails get overlooked far more often during a routine exam. Outside of nephrology or dermatology clinics, this sign rarely gets mentioned at all, largely because most general physical exams don't include a close look at nail color as a routine step. Patients are honestly more likely to have this pointed out by an observant family member than by a doctor during a rushed appointment, which is exactly why it's worth knowing what to look for yourself. The move here is specific. If you notice this two-tone pattern with a sharp dividing line, ask for kidney function blood work, creatinine, and estimated glomerular filtration rate specifically. This matters even more if you're also noticing swelling around your ankles, foamy or bubbly urine, or fatigue that doesn't match your activity level. Kidney disease is notoriously silent in its early stages, and a visible nail change can occasionally be one of the earliest external clues available. Now we arrive at number 1, and unlike the previous 4, this is the sign where waiting even a few weeks can genuinely change the outcome. Number 1 is a dark streak running the length of a single nail. I want to walk through this one carefully because it's easy to either dismiss it completely or panic unnecessarily, and neither reaction serves you well. A brown or black band running vertically from the base of the nail to the tip, most often on the thumb, index finger, or big toe, can be a warning sign of subungual melanoma, a skin cancer that develops underneath the nail itself. Here's the nuance that matters most. A single dark band in one nail is very different from what's normal for a lot of people. In individuals with darker skin tones, some degree of nail pigmentation is extremely common and usually completely harmless, by some estimates, close to universal in Black adults by age 50 and common in Asian populations as well. What raises genuine concern is a band that's new, that's changing in width, color, or speed of growth, that's wider than about 3 millimeters, that has blurry or irregular edges instead of clean parallel lines, or that shows more than one shade of brown or black within it. A band confined to a single nail, especially in someone over 50 with no history of that band before, deserves more attention than nail changes that are stable, symmetric, and present across multiple nails for years. The single most important detail to watch for is called Hutchinson's sign, pigment that doesn't stay contained under the nail but visibly spreads onto the surrounding skin fold. When that's present, it's one of the strongest visual indicators of melanoma that exists in dermatology. And here's a detail almost nobody knows. About 25% of subungual melanomas produce no dark pigment at all, showing up instead as a pink, red, or flesh-colored area under the nail, which makes them even easier to mistake for an old injury or a minor infection, and is a major reason this cancer gets caught so late, so often. The survival numbers make the urgency clear. Early-stage melanoma, caught while still confined to the top layers of skin, carries a 5-year survival rate around 97%. By the time the disease has spread to distant sites, that number falls to somewhere between 15% and 20%. The tragedy is that subungual melanoma is frequently misdiagnosed early on as a bruise, a fungal infection, or simple trauma, which is why most cases aren't caught until they've already reached a more advanced stage. The same rules apply just as strongly to toenails, particularly the big toe, which is actually one of the more common sites for this specific cancer to develop, and one people check far less often than their fingernails, especially in colder months when feet stay covered. One reassurance worth mentioning, especially for anyone who wears regular polish or gel manicures. Routine nail cosmetics do not cause this condition, and normal use has no bearing on your risk either way. The concern here is specifically about pigment originating in the nail bed itself, underneath everything, not anything applied on top of it. One practical tool worth using on anything borderline. Take a clear photo of the nail today, with a coin or ruler beside it for scale, and take another in 4 to 6 weeks. Memory is a poor tool for detecting slow change, and a genuine side-by-side comparison tells you far more honestly than trying to recall what it looked like last month. If the photos show growth in width, a shift in color, or the border becoming less defined, that's your answer, and it's time to get it looked at without further delay. Here's the one instruction that matters most on this entire list. Any new single nail dark streak in someone over 50, especially with irregular borders, changing appearance, or any pigment touching the surrounding skin, needs a dermatologist's evaluation within days or weeks, not let's watch it for 6 months. A nail matrix biopsy is quick, low risk, and is the only way to know for certain. If it turns out to be nothing, you've lost an afternoon. If it isn't, that appointment may be the most important one you make all year. Here's the recap in one breath. Spoon-shaped nails point toward your iron levels. A curved fingertip and a vanishing Schamroth window point toward your heart and lungs. Ground glass white nails with a narrow pink tip point toward your liver. A sharp two-tone split points toward your kidneys, and a new single dark streak, especially with any pigment touching the skin around it, points toward your skin and deserves the fastest attention of all 5. Now I want to hear from you. Of these 5 signs, which ones sound familiar? Have you noticed a nail change you've never actually mentioned to a doctor? Tell me in the comments, and tell me you'll take 30 seconds tonight to actually look. None of these 5 signs guarantee disease on their own. Nails change for dozens of harmless reasons, from fungal infections to old injuries to plain genetics. But each one is a legitimate reason to ask a specific, targeted question at your next appointment, instead of staying quiet about it. And before you go, there's a related warning sign hiding in a place almost nobody checks: your tongue. Certain color and texture changes there point to some of the same organ systems we just covered, and sometimes show up even earlier than your nails do. That's what I'm covering next: the 3 tongue changes worth checking in the mirror tonight.